Hi, my name is Victoria, and my speech to inform is about the warning signs of a stroke. They don't discriminate against age, gender, race, even your health conditions. Strokes come out of the blue, and they can leave you with little or no time to react. So knowing the warning signs of a stroke could potentially save your life or somebody else's. A stroke happens when your brain isn't getting enough blood, whether it's from a blood clot or the bursting or leaking of a blood vessel. And without getting proper treatment immediately, it can cause the person to become disabled, extremely brain damaged, paralyzed, and they can even die from it. I learned about strokes from an unfortunate disease called Fabry's disease. My grandmother suffered this disease for 11 years, which caused her to have 4 strokes, and she died on her 5th stroke, unfortunately. My stepdad, who was an EMT at the time, sat me and my family down and gave us the same spiel that I'm giving you about the warning signs, which actually ended up saving my grandmother's life. When I was over her house one day and me and my sister watched her face just go motionless and just the whole side of her face drooped. She was foaming at the mouth, her eyes were shaking. So I got my aunt's attention, who immediately knew it was a stroke and called 911, and that saved my grandmother's life. The main focus of my speech are the signs of FAST, the treatment of a stroke, and the feelings you might experience days or even a week before a stroke, which could potentially save your life. We'll start off by talking about the warning signs first. Signs of a stroke can be sudden numbness and weakness in the arms, legs, and face, and usually this happens only on one side, and it's been reported that the left side is the most common. Trouble seeing, trouble speaking, confusion, trouble walking, along with dizziness and loss of balance is also among the early warning signs of a stroke. To simplify these warning signs, your best bet is to remember that you need to act fast. FAST not only means being prompt and quick about finding help, but it's also an abbreviation for the warning signs of a stroke. The F in FAST accounts for the face. Ask the person to smile and see if their face droops to one side. If it droops, that's a huge indication that they are suffering a stroke. The A in FAST relates to the arms. Ask the person to lift both arms up in the air and see if one arm drifts downward. The S in FAST is for speech. Ask the person to repeat a simple phrase. Listen to see if their speech is slurred or disoriented. If it is, it could be the possibility of a stroke. Lastly, the T in FAST is for time. Time is so limited, so if you see any of these signs, call 911 immediately. The longer you wait, the worse the stroke will get and could ultimately result in death. I also learned through an EMT that documenting the time that the symptoms happened is very important because EMTs can act accordingly and know exactly when it started. Your best bet would be calling an EMT or 911 to send an EMT rather than calling your doctor or trying to get to the emergency room, because they are trained professionals and they will be there a whole lot sooner than you can probably even get in your car. Treating a stroke is my next topic, which can be extremely difficult. As I stated previously, a stroke happens when there isn't enough blood going to the brain or when there's a leak or the bursting of a blood vessel. Lab tests and imaging are the best way to determine whatever type of stroke you are having and the best way to treat it. Since you have to act fast when dealing with a stroke, your best bet is to call 911 because, again, the paramedics can be there faster than you can probably get in your car and drive to the hospital. The EMTs will treat the stroke right on the spot or on the way to the hospital, and usually once at the hospital, doctors will give a clot-breaking drug such as certain aspirins or blood thinner, which could help break up the blood clot. Sometimes it's given orally, also sometimes it's intravenously or like an IV through the veins. It is the most effective way to reduce brain damage as well as stop a stroke. It allows the blood flow to go back to the brain and for you to function as normal. Stent surgeries, other medications, and even scraping the arteries can also be a treatment and help reduce the risk of another stroke. After suffering a stroke, most people receive forms of therapy to get them to function normally again. Sometimes the speech or motor skills can be damaged from a stroke, so therapy is usually pretty effective. Lastly, there are key signs of a stroke days before it even happens, but not everyone's lucky enough to have these warning signs prior to a stroke. The most common is a headache. Most people don't think anything when they feel a headache and they just push it to the side, but it could be life-threatening. Numbness in limbs, fingers, toes, even the face could also be a warning sign that a stroke is coming. Lightheadedness often occurs too, not to be confused with a headache. Sometimes your vision can get kind of wonky, and that could be an indication of a stroke as well. Also, keep in mind someone's speech. That's a huge key to a stroke, so listen carefully if you hear somebody speaking and it's not making sense or it's a little slurred. Most of all, pay attention to the behavior or body language of yourself or a loved one. It can happen to anyone, anytime without warning. Hopefully this has opened your eyes to the dangers and risks of a stroke, but that the warning signs could potentially help you save your life. In the United States alone, about 25% of people will suffer a stroke, and if it isn't you personally going through it, it could be a loved one or a complete stranger, and it might be up to you to save their life. There is so much research being studied about strokes, and hopefully someday there is something so that we don't have to worry about it as often as we do. 1 in 4 people over the age of 25 will get a stroke, and that's very scary. 25 is so young. So it's good to be mindful and to be educated about the symptoms of a stroke that could potentially save a life. Thank you.